Hello, how are you? Welcome to this session on nursing care case study. In this area, we're going to look at how to write the nursing case study, but with key focus on the patient admission process and the management. So for those who've been following, the nursing care case study is a series that we are doing, and we are exploring step-by-step guide on how to write an excellent nursing care case study. So if you've been stuck and you're really wondering, like, what am I supposed to do when I'm writing a nursing care case study, this is the series for you. So you can just go into our playlist that we have highlighted as the nursing care case study and be able to begin one step at a time until you understand how to write a proper nursing care case study. It highlights the different parts. So we've started with the introduction, we've gone into the different components, and then now we are doing the writing part. How do we write it? How do we compile it? So we began by the history taking, we moved to the physical examination, and then now we are doing the patient admission. So in all these stages, we are taking you through how to write it, how to organize it, and the different bits that you need to discuss. So if you're new, my name is Winnie Barawa, and this is a YouTube channel that focuses on providing lectures, providing lessons, and deep interviews pertaining healthcare content. So if this is somewhere that you may really like, please don't forget to give us a subscribe, like our videos, or give it a thumbs up, and then click on the notification bell so that you can be reminded when we post our next lessons. And don't drop out. Keep up with our videos all the way to the end so that you enjoy what you are learning here. So when it comes to the patient admission, there are different components that are very key for one to talk about. So the first part is talk about the type of admission that the client has gone through, then provide a general survey. Survey is how did you receive the patient? So we'll go into details on this later on. The other component is reaction to hospitalization, or the patient reaction to hospitalization. Then we provide immediate management on admission, discuss about the subsequent management of the patient, which should include the medical and the surgical management, and then you also talk about the nursing management. So after this, now we bring in what to talk about the patient discharge. So don't worry, we're going to discuss all this in details, but these are the components that should be included in the patient admission part when we are writing our nursing care case study. So let's begin with the first part, type of admission. So the type of admission here, we want to see, or rather your supervisor will want to see, do you understand in which format of admission the client reports to the hospital? So there are some common admissions that a client can have. And this is number one, you can have an elective admission whereby our client had a pre-arranged how do I put it? It's where the client pre-arranged for the whole admission process, and there was prior arrangement that were done, there was prior agreement, consent, and all these procedures done. Basically, the admission was due to the patient choice to be admitted. So mostly this happens for illnesses that have routine follow-ups like pregnancy or expecting mothers. Most of the time, they might have elective admissions if maybe they're planning for elective surgeries or such and such. And then we have the direct admission. This is a form of admission that is given to a patient where they don't have to go through the emergency department for them to be taken to the wards. So what happened is there's some instances where there's a transfer of a client from a different hospital or from a different unit, and they may just do a call to the hospital, and this client will be taken straight to the wards or into the admission wards because they may not need to go through the emergency department. So that's what direct admission is like. Or it could be a call again made from different settings, and the client who's being brought in is being brought in with the intention of directly being admitted to the facility without passing through the emergency department. Then we have a holding admission. In the holding admission, we are saying this is an admission which is treated as an observation admission, whereby the client is in or is admitted in the hospital with the aim of observing their progress, mostly for a maximum of 48 hours. So the client can be put in the hospital for like 24, that is like a day, or 48 hours, it is like 2 days. The main agenda is to either observe for their investigations, check for the removal of maybe specific procedures, or this is just an observation check where you don't want the patient to go home. You want to ensure that they remain in the facility for you to observe their progress. But the maximum is they need to be in the hospital for maximum of 48 hours. Again, we have the emergency admission. In emergency admission, this is a case where there was no prior plans and the client had not intended or planned to be admitted. So emergency admission normally are done for critical conditions or critical cases who are not on any observation or they were not on any plans. And what happened is they urgently need to be taken into the hospital or facility admissions. So as we describe these admissions, the student can describe sometimes using another way. That is where you can talk about index admission or readmission cases. When you say index admission, here we mean first time, like the client, this is the first time they're being admitted in a health facility and they have never been an admission case before. But then you can also describe in form of readmission, where we're saying the client was admitted before and she's coming back whether for the same disease or for a different diagnosis, but they have been an admission case before. That's what readmission means. And then after describing readmission or admission status, you need to talk about the general survey. So here we are giving general status of the patient at admission before starting with any management. So the patient has been admitted, they have arrived into the admission wards, and now you want to describe about their general status while they arrived in the wards. So you want to give us a brief reinstatement of the general findings that were taken during the physical exam. So if the patient was done a systemic review or systemic assessment, you may want to do the PICOL assessment and say there's no pallor, there was no icterus, that is the components of jaundice. You want to talk about the issues of oxygen level, like you want to describe all these key parts of the PICOLs, and you want to ensure that the general survey of the patient comes in as clear as possible. So give us a small statement of the general finding that you find on this patient before you did the formal admission part and initiated management in the wards. So provide a general survey of that patient. If you're stuck on this, you can always refer to the general findings or general survey that was done during the physical exam or the general survey that was given during the history of presenting illness. You can use those to help you get a clear general survey of your patient before the admission and before you started the management in the wards. Then we have the third part of our patient admission, that is providing patient reaction to hospitalization. Now, remember, patients have anxiety, or rather, they go through different ways of reaction when they have been admitted or they have been placed in any hospital settings or in management settings. So in this case, you can describe the different reactions that they could have. It could be denial, it could be anger, depression, anxiety, grief, guilt, fear, sadness, loss of control, name them. So here as a student, it's needed that you describe the patient's reaction to the illness and the current status that the client is displaying. So this is a component that we need to ask the patient. What is your perception to your current status? What do you feel about it? It's an explorative area. And in here, as the patient has settled in into the wards or has settled in into the admission setup, you need to ask them about their feelings and their perception pertaining the current status. Are they worried? Do they have some questions? Do they have state of guilt? Are they fearful? You want to establish their reactions to this hospitalization setting, and you want to describe that in detail. So you can maybe say patient verbalized aspect of fear and they are showing loss of control to this and this. So you want to understand your patient in details and what they feel or they perceive or what is there basically in their minds when it comes to the hospitalization setting. So in this part, our key focus is to describe the immediate management that was done on the patient upon admission. So most of the time, this level, we end to describe a continuation of the management that was brought in from the emergency department or from the casualty department. So what you're required to do is to give a summary report of the management that was given on this patient on admission before we go into the detailed subsequent levels. So what happened is we can talk about issues like vital signs, like what are the vital checks, what do they indicate, and what is the status of the patient as a start. Then we can describe what we call investigations. So we can look at the investigation and highlight the findings that we found. That is the admission investigations. And this is the state where we bring in the routines that were done because most of the time in the emergency department, there's a lot of routine investigations that are done to just establish the foundational or impression diagnosis. So in this case, you can describe the investigations that were done for your client, and then you can say upon admission, there were certain treatments that were given to this patient. So you can also describe the treatments or the medical interventions that were given to this patient. But you can also briefly touch about nursing care that was done, like was there any form of oxygen administration? Was there pain management? Was there positioning? Just a slight brief introduction of the management that was done on this patient on admission. Then we get to have to talk about counseling. This counseling most of the time also comes out strongly as part and parcel of health education for our patient. But now remember, this is a patient whom we are looking at their reaction to hospitalization, and we have explored that reaction in our previous step already. So we have established if the client has grieving, if the client has any form of loss or loss of control, if they have anxiety. So counseling or psychological counseling becomes part and parcel of the immediate management of it on admission. So this is a picture of what you can initiate as immediate management and what can be described when we are developing the document on the case study. So in the case study and the immediate management, we describe in summary what was done. Could be in the emergency department or it could be in the ward upon receiving this patient from the emergency department, or depending on the type of admission that the patient has come in, whether it's a direct, whether it's a holding admission or whether it's an emergency admission, but you want to give us a picture of what did the nurse do immediately this patient came into the admission setting. Was there vital checks done, investigations, and what were results? So you want to give this and tell us a summary of what were they meaning and what were you uh, initiated to do after that. So that's what caters for the immediate management on admission. Before you plan to going into the subsequent management. And then now from there, we need to describe now in detail the subsequent management of this patient. So in the subsequent management, we are going to show the management of this patient till discharge. So you want to show management of this patient till discharge. So for example, here you can start either with surgical management if the case we are describing is a surgical case. And in the surgical management, we can describe components like surgeries. We need to provide those components about the surgical management. Are there surgeries the patient go to theater and then provide any description of invasive procedures that could have been performed on the patient. So in the surgical management, it's normally advised that the student tries to bring in description about the pre, the intra, and the post-operative management. These are very key. So you can describe what happened before going for these surgeries, what are the intraoperative management that were done, if you can have access to that, and then provide the postoperative management that the patient received. All this you can flow with them until discharge levels. But then on the medical management, most of the time here, it comes strongly in form of the medication and treatments that were given to the patient and attach treatment sheet if possible. So attach the treatment sheet if it's there. And in the medical management, we are required here to describe in details about the treatments. So in the describing of in details about the treatments, we are expected to describe the drug class, the mode of action, the dosage and how you calculate the dose. We are expected to describe the route of administration of that drug, the indications and contraindications. You need to provide the side effects or the adverse effects. And then being a nursing case, we need to pull in the nursing roles and responsibility pertaining to these medications and drugs that you're administering to the patient. So in the management, it's supposed to be as exhaustive as possible. So for the surgical management, we are focusing on the surgical interventions, be it surgeries themselves or any invasive procedures that can be done. And we are saying you need to pull in the preoperative, intraoperative, and the postoperative management. Then when it comes to the medical management, we are looking at medications and the drugs given, but we're also supposed to attach evidence by pulling in the treatment sheet that the patient was used in, by describing the drugs classes, the mode of action, the dose, the calculation, the route of administration, the indications and the contraindications, the side effects, adverse reactions, and then nursing roles and responsibilities. So that's what caters for our management part. That is the first part. But don't forget here, we need to do the last part, which is nursing management. And that's what you're going to discuss next. So in the nursing management, this is where now, being the nursing fraternity, you need to put in all your components together and make sure that you describe the nursing management as comprehensively and as detailed as possible. So what is required under nursing management? Here we are expected to describe the nursing management using the nursing process. So one is wondering, how do I put this together? So when you're describing the nursing management, you start with the nursing management by doing the nursing process first. Here we are going to use the PROS form. So we're going to start with the assessment by stating the different cues and symptoms that are pertaining to this client. And then the second bit, you're going to state the nursing diagnosis, or you're going to provide the nursing diagnosis, and then do the planning stage, implementations, and then the evaluation. So you need to do that. Now here we are focusing on the PROS. So in PROS, basically you're describing this in paragraphs and we are not drawing the nursing care plan yet. But now it comes to the second bit, we'll talk about the comprehensive nursing care plan. So in here you have to describe a nursing care plan that is providing an actual status of management that has been done on the patient. So we're going to provide a 24-hour care plan that has been implemented on the client. You may not draw all the care plans for the time the client has existed in the ward or in the admission setup, but you can give a nursing care plan that will, represent the care that the client has received in form of a nursing care plan. So you have to highlight that in detail and give it a 24-hour care plan. You should attach this as part of your evidence. But then the last part of our nursing management is the patient progress. So in here, you will be required to provide, or rather you're required as a student or as a nurse to provide the patient progress from day one all the way to the last day of their management. So we'll be highlighting the progress is form of day one. You describe, that is the day she was officially admitted in the ward. You provide the management that was given. Day two, you describe the management that follows. Day three, day four, all the way to the last day that the patient was almost being discharged. So the patient progress follows a daily routine. And where do you get patient progress? You will get this from the CADEX or from the nursing CADEX, because this is where we provide the daily management of the patient in terms of shifts. So if you're stuck and don't know where to get the patient progress, you can get that from the patient cardex. So go to the patient cardex and access the daily management that was being given to the patient, and you summarize those into 1 day at a time until the last day of the discharge. So what are we told on this level again? Remember, we are saying nursing management has to be very exhaustive. So we are told under nursing management, we're going to be required to attach interventions related to the management. So what interventions can we give? Remember, we have done the nursing process in prose form, paragraphs. We've done the nursing care plan covering a 24-hour schedule, and then we've done the patient progress, outlining all the days of the management that they have been in the admission ward. Now, the last bit is bringing in the intervention evidence. So you can attach there if it is an input-output monitor chart, if it's a weight chart, if it's a nutrition chart, if it is a neuro management chart. Like, bring all these management charts or monitoring charts that shows all the different nursing care management that was given to this patient. So here you're not just going to describe things without evidence. You'll be required to provide evidence for each and every intervention that was given. And the last part of the patient admission process is on the patient discharge. So we are required to provide details of the discharge procedures that were done to our patient. And one of it is this information here about covers the discharge summary, which should be accompanied with a photocopy for attachment. So in the discharge summary, there are different components that are normally highlighted there. For example, the disease that was client was treated, the attending doctor of our patient, the aspect that were catered for by the wards, a summary of the management that was basically done on the patient. So the document that provides this data, we call it the discharge summary. So we are told as a nurse and you're doing this case, or when you're doing this case report, you need to get a copy of that summary attached. And then the other part is other services that could have been given to the patient. Remember, as much as it's a nursing care case study, we have other support management that were offered to this patient. For example, you can have support devices that were used. We can have physiotherapy cases that was our physiotherapy services that were offered. We could be having occupational therapy care, the social services, or any other specialist services that were given. So it is good that this is also highlighted within the patient discharge. And then there's the return date and the follow-up date that has to come out clearly. Then the health education that was given to our patient before the discharge. So these are components that should be highlighted in the patient discharge. Give a summary of the discharge summary and provide an attachment of the same. Describe other management that was given to this patient. Give the return dates for follow-up that was highlighted for your patient, and the health education that was given before the patient was released. So these are key and parcel of our patient discharge process. So we've said that in the patient admission process, we need to highlight different components. So we told you need to highlight the type of admission that the patient has been done. You want to highlight the patient reaction to the hospitalization process. Then we want to now describe the general survey of this patient before initiating any management. Then you want to bring in the immediate management that were done to our patient upon admission, then the subsequent management that were done to this patient all the way to the discharge level, where we are now talking about the patient discharge that caters for different aspects, including providing the discharge summary, other services given, the return dates, and the health education. Thank you again for being with us all the way to the end. Please don't forget to like our video, comment, share, and also subscribe. I appreciate your presence, and don't leave yet. Always go back to our playlist and check on other videos that we've not watched pertaining our nursing care case study. Otherwise, see you in our next lesson.